After this allergy section is over, we are then moving on to the neurology and the neuromuscular procedures. Here we are going to see something called as actigraphy. The physician is going to record the movement of the gross motor muscular activity. Okay, next thing is like sleep study. In a sleep study, what happens is patients who suffer from OSA, we call them as obstructive sleep apnea, they are subject to this kind of study. In order to qualify as a sleep study, we should have a minimum time period of at least 6 hours. If that is not being met, then we need to assign modifiers like 52 for a reduced service. Then what we have to consider is also the age factor, and you also need to know whether it is an attended study or an unattended study depending on the presence of physician or the technician. So what are the things that are going to be studied in a sleep study is essentially they will be talking about the EEG, EOG and the EMG. A specialized form of sleep study is a PSG, which is a polysomnography. Polysomnography has so many parameters, of which the basic parameters are the EEG, EOG and the EMG. Here EEG is electro-encephalogram, EOG is electro-oculogram and EMG is electromyogram. So in addition to all of these, there are additional parameters like the ECG and the respiratory airflow, whether it is the nasal airflow or the oral airflow, and we have the respiratory effort and the movement of the anterior tibialis. These are also studied in the case of PSG. Now coming to EEG, it's an electrical recording of the activity of the brain. So what can we do here is like, here they are going to locate the activity of the brain that is going to be captured. So we have this routine EEG, and this EEG can be done in various stages like the patient in a sleepy state, the patient in a drowsy state, or the patient is in a wake up state. So we have asleep or awake or drowsy state. Plus you also should know about whether it is a kind of a specialized EEG or not, or to find out this epileptogenic focus. Some patients, they want to find out where this arrhythmia is developing that is causing epilepsy. For them, they will be placing a depth electrode. So that becomes a type of special EEG. Next we have like EOG, which is an electro-oculogram.